Yeah, everybody, yeah. So as we are celebrating independence, so it is almost 4th of July, as you can hear the fireworks. So today I'm going to talk about ARVs, anti-retroviral drugs, anti-retroviral drugs. So drugs used to treat human immunodeficient virus, acquired immunodeficient syndrome. Actually, the right term to use is AIDS. So this is the virus that causes this. So the drugs which are used, they cause side effects, which sometimes certain side effects can be unbearable to the patients, even sometimes can lead to unprecedented circumstances. So I'm going to quickly talk about the side effect with regards to the groups. So when we start with the most, so these are very potent ARVs, and they form the major backbones of regimens. So AZT, that is the zidovudine. This was the first antiretroviral to be manufactured. Initially, it was intended to treat cancer, but it showed more effectiveness or efficacy, potence with regards to HIV. So AZT can cause what we call anemia. Anemia is basically the reduction of red blood cells, erythrocytes. So it can cause anemia, neutropenia. Neutropenia is the reduction of neutrophils. So neutrophils are the type of white blood cells. It can cause also lactic acidosis, myopathy, which is a disease or disorder affecting the muscle cells. So how does AZT and some nucleotide reverse transcriptase inhibitor cause all this lactic acidosis and other side effect, myopathy and the other side effect? So we know that first, let's revise our biochemistry. We've got glycolysis. End product of glycolysis is lactic acid or lactate. So this lactate I think it is converted into acetyl-CoA. So it enters what we call Krebs cycle. So there's information indicating that there are some proteins called gamma proteins. So these gamma proteins are responsible for carrying lactic acid into the Krebs cycle to be converted into acetyl-CoA. Acetyl-CoA now lead to the formation of ATP. So there are a series of biochemical events. So zidovudine inhibit these gamma proteins. As a result, now lactic acid accumulates, leading to lactic acidosis. Yes, I won't go much into details. And then 3TC can cause rarely pancreatitis, which is the inflammation of pancreas, peripheral neuropathy. But 3TC, which is lamivudine, is usually well tolerated. Yes, well tolerated. And then we have also what you call non-nucleoside reverse transcription inhibitors, like efavirenz. So EFV is efavirenz. So if you're a medical student, it's better you know this abbreviation. Efavirenz, usually it causes CNS, dizziness, insomnia, and vivid dreams. So actually, so far in my practice, I've met patients complaining of this: hallucination, rash, liver toxicity, NVP, nevirapine, rash, liver toxicity. Protease inhibitors, they can cause turnover, can cause GIT, lipid abnormalities such as hyperlipidemia, high cholesterol, high triglycerides, insulin resistance, so can lead to diabetes, and even can worsen if someone is RVDR. So RVDR. So this is HIV positive status, retroviral disease reactive. So if someone is RVDR plus diabetic, so I think you shouldn't be given the return over. Lopina return over can usually nausea, diarrhea, and lipid abnormalities, even liver toxicity. So also we move to the next group, which is integrase inhibitors. So integrase inhibitors. So we're talking about the likes of leotegrava, like of dolutegrava. So leotegrava mostly is muscle pain, insomnia, and headache. Insomnia, so CNS like, and headache. Dolutegrava, widely used in Zambia, can cause also insomnia, can cause headache, and can cause what we call potential weight gain. So there is weight gain under dolutegrava. And then entry inhibitors. Maraviroc, MV. This can cause cough, fever, can cause fever. Let me see. Upper respiratory tract infections, joint pain, liver toxicity. Joint pain and liver toxicity. Enfuvitide. So this is basically CCR5. Excuse me. No, this is fusion inhibitor. The fusion. So this can cause phlebitis reaction, which is injection site reaction. It can cause also bacterial pneumonia. Can cause hypersensitivity reaction. So how do you manage this side effect? Management of side effect. So before going further, you have to know that there are some drugs which are very. So usually we weigh, we put a equilibrium. So this is so this is a benefit, risks. So if the benefits outweigh any risk, it's better we continue. So because, like, for example, when it comes to nucleoside reverse transcriptase inhibitors, they form the backbone of most ARVs regimen. For example, 3TC, AZT, TDF, TAF. They are very good, and they are very efficacious. There's efficacy, and then there's potency. So efficacy is basically the ability of the drug to produce the intended purpose, and then so this is the ability of the drug to produce intended purpose, and then we also have potency. It deals, so there's a strength of the drug, but in pharmacology it deals with the dose. So I won't go much into details. Yes, so how do you manage side effects associated with the ARVs? How do you manage? So number one, regular monitoring. Yes, so as they come for those regular monitoring, such as viral load, CD4 count, also do full blood count, especially if someone is on AZT. It can cause anemia, and I think when the HP is below 12 grams per deciliter, I think don't give AZT. Yes, so full blood count, or known as whole blood count or blood work, determining the HP levels, and also check the liver enzymes. Those should be transferase, I've forgotten them. And check the kidney functions. So check the creatinine and creatinine, glomerular filtration rate. These are indicators that the material, there is a toxicity. So, and also you can provide what we call supportive care. So if a patient is willing to continue the drug, if there's rash, you can give antihistamine cream. Like in USA, we have diphenhydramine cream, or in some cases you can even give hydrocortisone for just like 7 days to cure the rash. Yeah, for the nausea, usually in the initial days, like especially the first 7 to 14 days, there's usually nausea and vomiting and abdominal pain. So you can encourage the patient. You can give antiemetics, e.g. ondansetron. If the adult, even 8 milligram BD, maybe for 3 days. Yes. Yeah, so also hydration is very important. You encourage them to take a lot of fluids, increase fluid intake. Yes, can help. Yeah, so like when it comes to those drugs causing CNS, like side effects like vivid dreams, effervescence, encourage the patient to take a drug at bedtime. So say NOPT. Yes, to minimize dreaming during the day. If they take So you can also give oral antihistamine like I love cetirizine or promethazine, Finnegan. Cetirizine like 10 milligram OD, maybe for 5 days to minimize systemic, itching. And then tell the patient to avoid alcohol, hepatotoxins such as alcohol can worsen liver toxicity. And then you can give supplements such as calcium plus vitamin D, because for example, some nucleoside transcript inhibitors such as AZT, they cause what you call myopathy. Yes. And then for weight gain, exercise, gym. And then for those affect lipid profile, increased cholesterol, regular lipid profile checkups, determine low density lipoproteins, high density lipoproteins. Yes. Yes. So lastly, I'm going to talk about common fixed dose combination. We have what you call Truvada. It's a combination of Truvada's combination of tenofovir plus emtricitabine, commonly used in PrEP, pre-exposure prophylaxis, and also have a tripler. In a tripler, there's TDF, efavirenz plus FTC, emtricitabine. Yes. And there's a combination of like TOD is a combination of tenofovir plus 3TC plus DTG, dolutegravir. And also in America, we have this drug Cabenuva. Cabenuva is a combination of cabotegravir. This is a integrase inhibitor. And then we have rilpivirine, which is a non-nucleoside reverse transcription inhibitor. Yes. So this is what I had for you. Kindly subscribe to my channel, Abram Tutorials. Yes. And the tutoring and consultant services both on the Facebook and the Instagram. Yes. So next we'll do on the opportunistic infection. Yes, as we wrap up with HIV. Thank you. Bye bye, and happy birthday, United States of America. God bless you all. I love you all, and always believe that no matter what you're going through, there is hope. Shalom, shalom.